We're going to add, on top of yellow, orange, red, an emergency stop provision where if we hit a real hospitalization crisis, we could potentially do a New York pause. California just did a California pause, which is basically a stop, or move one zone to another if we have a critical hospital situation. Today, New York State Department of Health is going to initiate emergency hospital measures. Number one, every hospital has to identify retired nurses and doctors now. We're already experiencing staff shortages. Staff just gets exhausted after a while. They've had a horrendous year. To now go through this again with emergency rooms and a high number of COVID patients coming in, they start tired, they start sick. Start identifying retired nurses and doctors now. We did this last time. It worked very well. We're going to stop elective surgery in Erie County as of this Friday. Erie County has the most critical hospital situation in the state. So Erie County must stop elective surgery. Catholic hospital system in Erie County voluntarily stopped elective surgery just to be responsible. I thank them. It's now mandatory. They must all stop elective surgery as of Friday. Let's start to free up those hospital beds. If the situation continues to get worse, we'll stop elective surgery in other parts of the state also. Elective surgery are those surgeries that don't have to be done at that time, and we want available beds for COVID people, so stopping elective surgery does that. The individual hospital network load balancing is mandated as of today. Let me explain to you what this is. Talk about learning a lesson the hard way. There are hospital systems in the state that have a number of hospitals in their system, and they can be private or they can be public. Northwell has a number of hospitals in their system. Montefiore, ECMC, Erie County, URMC, Rochester, Kaleida, New York City, H&H. They are systems unto themselves, and they can have 7, 8, 10, 11, 30 hospitals in their system. It is mandatory as of today that they balance the load within their system. They balance patient load. So you distribute the patients among your hospitals in your system. The nightmare we went through last time was a hospital would be overwhelmed. But that system had other hospitals that had capacity. Well, then why didn't you shift patients from the overwhelmed hospital to the hospitals that had capacity in your own system? Well, that's not how we operate. Yeah, I get it. I learned that lesson. Forget how you operate. This is a mandate from the State Department of Health. You must distribute patients across your system so one hospital does not get overwhelmed. Well, the patients don't want to go to other hospitals. Then let's just end elective surgeries now, and we'll make it simpler. But no patient wants to be in an overwhelmed hospital because you're getting less care, the staff is stretched thin. It's in the patient's best interest, distribute the patient load over the system. We're not going to live through the nightmare of overwhelmed hospitals again. So those individual systems, they must do that now. If a hospital gets overwhelmed, there will be a state investigation. And if the result of that investigation is they did not distribute the patients, that will be malpractice on their part. This was a serious issue last time. It was a case of first impression last time. This time it's not a case of first impression. I don't mean to be difficult, but difficult is when people die because they didn't get the right health care. That's really difficult. So preparing for that is important. That goes into effect immediately. We also have to prepare emergency field hospital plans region-wide. Plan now for adding 50% capacity to your hospital. If you have 100 beds, you go to 150 beds. We did this last time. It was highly effective. We brought a system from 50,000 to a system of 75,000. Prepare to implement statewide Surgeon Flex. Statewide Surgeon Flex moves patients among systems, right? What I was just talking about was movement within the system, moving Kaleida patients within Kaleida facilities. Statewide Surgeon Flex moves patients among different systems. So theoretically, a patient could go from NYU Langone to Mount Sinai. You move them among different systems. That's a different level of coordination with a different level of emergency. And prepare to staff the emergency field hospitals. Also confirm the PPE stockpiles. Department of Health did regulations as to how many PPE you needed. 90-day stockpile of PPE. Confirm that you have those PPE stockpiles in place because we don't want to run through that again.